At Lindquist, our mission is to provide accessible, compassionate, and effective dental care to South Sound children in need. And we turn nobody away due to inability to pay, and we serve children from birth to their 21st birthday.
I worked 30 years as a school nurse in Clover Park School District. In Clover Park, we have a lot of low-income families. The problems we saw were tremendous. Abscesses, large cavities, things like this. How are the kids going to learn in school? How are they going to eat, and how are they going to sleep?
Tooth decay is one of the #1 reasons why low-income children miss school. They have pain, they have infection that severely impacts their learning, and a lot of times it also impacts their self-esteem. Because when these kids have big cavities, brown spots in their teeth, they're embarrassed.
We've seen kids be able to go from being shy, or they're ashamed, or they're afraid, and now they can give them that confidence to be able to enjoy life.
Last year, we provided about 24,000 patient visits to over 14,000 unique children in our community. Even though we're not reaching everybody we want to, that's a lot of children that wouldn't have otherwise gotten that care.
95% of the kids we're seeing are state insurance kids. 50% don't utilize the dental care portion of it. We want to let folks know we are here, we are a resource, we can see your kids, we take any type of insurance. If you don't have insurance, we're gonna make it happen. We're gonna take care of your child.
All right, let's take a look. Can you give me 5?
A big part of what we do is through what we call our uncompensated care fund. 42% of our families have some type of uncompensated care. And we provide about $400,000 to $500,000 a year that covers costs that they wouldn't necessarily be able to pay for.
When you are coming to a dental clinic that serves the underserved, people think that you're getting subpar quality treatment. Let me just tell you, we really have some doctors that know what they're doing, they are well educated, and they are here because they care.
Families in our community feel like home when they come here. And we're centralized here in Parkland and Pierce County, which is a very diverse community. So when our mission is to serve folks of color, folks that come from low-income families, marginalized communities, it's important that our staff represent the communities that we want to serve.
We have children that come and they say, "Mom, she looks just like me." There are kids that come in that literally have a mouthful of decay, and I'm talking that they need work done on 12 to 16 teeth out of 20. We are able to offer 2 brand new services. One of the things that we are doing are putting kids that are between the ages of 3 to 8 under general anesthesia, so we can get all of that work done at one time. The next day, they're back to school, they're having fun, so it's just been wonderful to see and a wonderful addition to our practice. Oral surgery is another addition to the practice. They are able to see the kids here and get these wisdom teeth extracted, cutting down the wait time from 6 months to literally weeks.
Lindquist is focused on providing care outside of the 4 walls, and it really is getting to the community.
We have school-based services, we have our community outreach. Just us being out there, letting them know that we're a resource, it helps get kids connected to dental care.
When we do our screening, sometimes we see up to 400 kids in a school in one day, be able to screen them, give them referrals, and kind of identify the children who may need additional services. And then when we do come back and provide those services, sometimes we see upwards of 80 kids in a day, and it's so heartwarming to be able to provide those services that they may not be able to otherwise get.
Show me how you brush those teeth.
It takes a lot to be able to support and run an organization that provides $400,000 to $500,000 of uncompensated care a year, that pays the team and the staff and trying to be competitive in our wages. And it's because of our donors and our funders that we're able to do that.
It was really important to me when I went to dental school to be able to come back to the community I grew up in and give back. If we start early, if they come in like they should regularly, if they're comfortable with their dental environment, we can impact these kids. We can reach these kids and make a difference. And we can be your dental home here.